Just wanted to talk a little bit about a new review paper that we have for JDD, talking about deucravacitinib, which is a new novel oral therapeutic for the treatment of psoriasis, and the different things involved in terms of safety, laboratory monitoring, efficacy, and appropriate management in clinical practice. So we just kind of wanted to talk a little bit more in detail about that. And then one of the key emphasis that we had in this expert consensus panel was talking about the safety and the laboratory monitoring that was involved with it. And, to sum it up, of course, we go into more detail about the various things that are involved with that. But essentially, deucravacitinib doesn't require laboratory monitoring, which is different from a lot of drugs that require, quarterly or even every 6 month different types of lab monitoring and things of that nature. And then we kind of went into pretty great detail covering the various studies to date that have been done, looking at the various safety signals, as well as analyzing the efficacy and appropriate management, how to appropriately use deucravacitinib and then manage that appropriately. And we crafted 6 consensus statements. And I was lucky to be part of that, involved a lot of different experts who are, some of the most world-renowned dermatologists when it comes to treating psoriasis. And these are their opinions that they formulated, not only based off of literature, but also based off of their clinical experience and what they do in treating their own patients as well. Basically, what the expert consensus panel, after reviewing the plethora of clinical data as well as their own personal clinical experiences, the group came to a conclusion that clinical, lab monitoring isn't required for patients being treated with deucravacitinib for plaque psoriasis. And, of course, the JAK family carries a number of different black box warnings and considerations when it comes to different lab abnormalities that can be associated with that. And the label for the FDA for deucravacitinib actually mentions elevations for CPK, liver function tests, as well as triglycerides. But what you can see, and we go to this in greater detail in the paper, of course, is if you look through all the data, there isn't substantial evidence to support that trend being true. And so our experts strongly believe, based off of the evidence, that you can very safely administer this drug day to day to your patients, and be confident that it doesn't warrant any more additional drug monitoring than you would for any other orals in the same drug class, or rather in the treatment class, or placebo.